Hello everyone, Dr. Martin here. The BBL is designed to give you a good shape as well as a good size of your gluteal area. But there are certain risks involved with it. In this video, I explain to you exactly what can go wrong as regards to the procedure of a BBL. Enjoy. Thank you. Hello everyone, Dr. Martin. Today I want us to focus on the complications of a Brazilian butt lift, or the BBL. What can go wrong during or after the procedure of a BBL. Like I said earlier, a Brazilian butt lift is essentially where we harvest the patient's fat, not someone else's, but the patient's fat. We process it and then we put it on the gluteal area, try and give the patient more volume and of course a better shape as well. So many things can go wrong with this procedure. It's important for us to know them, and this discussion usually must be had with the patient. So today's focus is on the complications. Among the things that we'll go through are fat emboli, fat necrosis, or fat death, like when the fat dies. We shall also look at asymmetry. We shall look at seroma. We shall also look at infection. What else can happen? Maybe what we call oil cysts as well. Yeah, these are the main things that that can happen when one does a BBL. And I'll try and go through these as simply as possible. We'll start with this big one known as the fat emboli. The fat emboli was a very serious complication earlier, back in the day. A fat emboli meaning that the fat which you have gotten from the area where it was located, then as you're inserting it into the gluteal area, that fat can easily get into the bloodstream, and then it's taken up into the blood system and can potentially block the heart or the lungs and kill the patient. It is definitely the most serious complication. It used to be more prevalent earlier in the years when the BBL was starting out, and the main reason being that in those days, if we consider this is the butt, I hope it can be seen. In your butt, there's this is your skin. Then there is there's your subcutaneous tissue, which is basically where most of your fat is located. And then below that is your muscle. So this is your skin. Below your skin is your fat, and then below that is your muscle. So in the earlier days when BBLs were being done, they would get that fat and inject some of it into the muscle. And inside the muscle, you have really big blood vessels, and you could easily inject that fat into the blood vessel. It goes into the system and blocks the heart or the lungs, and eventually potentially killing the patient. But that has reduced. Why? Because now we tend to emphasize injecting the fat in here, in the subcutaneous area. And because of that, the deaths related to a BBL because of the fat emboli have gone down. Why? Because we're injecting it in an area where we think it is much lower, or the risk is much lower of you injecting that fat into a big blood vessel and causing this potential big complication. So that has now gone down compared to the earlier days when BBLs were being done, because we are now injecting it in the right places rather than injecting it in the muscle where the risk was much higher. But you still have to have a discussion as the potential risk of this happening, the fat emboli. The second big one is fat necrosis, which basically means your fat dying off. Like I said earlier, you are picking this fat from an area where it's been located, or where it's located. Where it's been located, it's been supplied with blood, so it has been getting nutrients, oxygen. Now you do liposuction, and then you get it off the things it has been getting. Then you put it in a new area, and you want that fat to now pick up a new blood supply to get nutrients, get oxygen. Now, sometimes that process of getting up a new blood supply where you put it may not happen. And that's why all the focus during the recovery is try and have as many of the fat cells picking up a new blood supply and surviving and giving you the expected result. So fat necrosis can be as high as between even 40 to 60% of the fat dying. But with the recovery methods that are now out there, you can most between about maybe 60 to 80% of the fat can survive these days. But it's a very serious complication to talk about because it can happen even in the best centers. And that's why most centers will just try to, or most surgeons just try and harvest as much fat as they can. They put in the gluteal area and hope that even if some of the fat dies, you have a bit more of the fat surviving to give you a good enough result that you wanted. So fat necrosis is really, really an important thing to have a discussion with the patient because it happens. You only want as little of it to happen so that you can get a good result. The other thing is asymmetry. Asymmetry basically meaning that they basically don't match. You might have maybe one side looking different from the other. Because one of the key things when you're doing this procedure is you want both of the gluteal areas look the same. But for one reason or the other, maybe on one side the fat takes and the other side it does not take as much. Maybe the protocols during the recovery are not followed. Then there's always a risk of them looking different. And that's what we call asymmetry. And that discussion must be had with the patient as well. The other thing is a seroma. A seroma basically meaning the collection of fluid, especially in areas where you've done that liposuction. Remember, we need to get that fat from areas where it's located and put it in a new area. So where you got in that fat, you've created a potential space, and that space can be filled up by fluid, and that is called a seroma. That's why you put in that compression garment to try and reduce the risk of that happening. But it's really, really common for a seroma to form in the recovery of postoperative period following a BBL or just following a liposuction. The other one is infection. The infection can be on the skin or superficial, or can even be deep into the tissues. And it can even be severe enough to cause a collection of pus, what we call an abscess. And when usually that forms, that means you have to take the patient back to theater and remove that collection of pus. It's not as common, but it can happen, and it's good to have that discussion with your patient. Infection as well. The other more rare is the oil cysts. It's basically a collection of oil just below, at the level of the subcutaneous layer here, where you put the fat. You might find that some of that fat might die off and then leave behind like a collection of oil. And that can sometimes leave a confusing picture because it might look like it's like an infection, yet all you have is just what we call an oil cyst. So these are some of the common complications or some of the bad stuff that can happen following a BBL. And it's really, really important to have this discussion with the patient before they go through the procedure so they have a good understanding of it. And everything we try to do is try and get you out safe, alive, and at the same time with none of these happening to you. So, but they still can happen. So yeah, so these are the general complications that can happen following a Brazilian butt lift. Thank you.